It's time for Morton in the Morning on WVBF, a weekly get-together with your friends at Morton Hospital. Coming to you every Wednesday at 11:05 a.m., Morton in the Morning brings you full access to the latest hospital news and health information. Stay in the know about important health and wellness topics, new doctors and services, and upcoming events. And get to know the team at your community hospital. And now, Morton in the Morning.
Good morning, everyone, and welcome to today's Morton in the Morning show. Coming to you every Wednesday at 11 a.m. right here on WVBF, your hometown radio station. I'm your host, Julie, and we are broadcasting right here from Morton Hospital, your community hospital in Taunton. We appreciate you tuning in every week, and we hope you've been enjoying our shows. Last week, we had an excellent interview with Brienne Wapenier. She is an LICSW with our psychiatry team here at Morton Hospital, and we covered many topics related to mental health and wellness. And she provided a lot of great tips on stress reduction and, reducing the stigma associated with mental health, and, how to support others who appear to be struggling. And there's so much to talk about and discuss around this topic. So today's show is also about mental health. We will be interviewing two new team members from our psychiatry team. And we're going to be talking about, mental health services available in our emergency department. Also, some of the new programs that we have for treatment of some common mental health programs. So before we get into our interviews, just a few announcements. We are very excited to hear that the 2022 Best of the Best Community Choice Awards is up and running. This year, we have made it to the top 5 and made it to the voting round in 6 different categories. So we want to thank our community so much for nominating us. Those categories are Best Hospital/Medical Center, Best Audiology Specialist, Best Orthopedics Center, Best Physical Therapy, Best Places to Work, and Best Weight Loss Center. So we are so thrilled and humbled by all of your nominations. This year we were nominated in all 6 of those categories. Last year in 2021 we did win 5 awards, and we're hoping to win again this year. It's a great way for us to recognize the outstanding work of our staff, our team, and our providers here at Morton Hospital for all they do for our patients and community. So we are very excited because the voting round kicks off next week on August 9th, and that will run through August 23rd. So you can vote for us daily. You're not limited to one vote, so you can log in every day and vote for us in those categories. You can find the voting link on the Taunton Gazette website or the Brockton Enterprise website, or we'll also be posting it on our Facebook page, which is facebook.com/Morton Hospital MA. Make sure you follow us on Facebook to find that link, but also to stay up to date on everything else happening here at Morton Hospital. So thank you again for all of your nominations, and we hope that we can count on your vote during the 2-week voting round starting next week. So lots of great content today, and so let's jump right into our interviews and welcome our first guest. So our first guest is David Vertuka, and he is a member of our outpatient psychiatry team here at Morton Hospital. We're very excited to have him here today to talk about a couple of the unique programs that they have. So welcome, David.
Thank you.
So tell me about yourself and your role here at Morton.
So I was born and raised in Massachusetts. Mm-hmm. I currently live in Franklin with my wife and 10-year-old son.
Okay.
My educational background is in psychology.
Nice.
I'm a graduate of UMass Framingham. I've been working in the mental health field for 20 plus years, the majority of which has been with Steward.
Okay.
Previously, I was the ECT coordinator at Norwood Hospital. I transferred to the new ECT program here at Morton Hospital in the fall of 2020. My role is ECT coordinator. I have general oversight of the program, processing referrals, treatment plans, and patient records, scheduling appointments and corresponding with providers.
Okay. So let's talk about ECT, because I think that might be a new term for many people, and that stands for electroconvulsive therapy.
That's correct.
Okay. So what exactly is that? Because of course it sounds a little scary with the electro piece. So,
Sure.
What is ECT? How does it work?
Okay. So ECT, electroconvulsive therapy, it's a procedure done under general anesthesia in which a slight electrical stimulation is delivered to the brain, triggering a brief seizure, which causes changes in brain chemistry that can quickly reverse symptoms of mental health conditions. More specifically, it stimulates neurotransmitters in brain cell communication.
Okay. And so this is something that's really safe?
It is.
Okay. How long has something like this been around?
It's been around for many decades.
Oh, okay. So it's not new.
It's not new. No, it goes back to, I believe, the 1950s. And it's over time been perfected, we could say.
Okay. I know I've heard Dr. Batista refer to it as like the gold standard of treatment for certain types of people. So
it is, because other forms of treatment, if they're not effective, ECT is a viable option that is generally highly effective. Studies have shown about an 85% success rate.
Okay, excellent. So let's talk about the types of patients that you would use ECT for.
So most commonly, severely depressed patients who haven't responded to other forms of treatment such as medications. ECT can also be effective with treatment of bipolar disorder and schizophrenia.
Okay. And so let's talk about like the actual, what happens during. So are there things that you have to do to prepare for this treatment?
Yes.
Okay.
So prior to ECT, a full history and physical and medical clearance is required. Also, ECT consultation in our outpatient clinic with the proceduralist, Dr. Leonardo Batista.
Okay.
If approved for ECT, the initial treatments are done acutely, meaning 3 times a week, before transitioning to maintenance treatment 1 time per week or less frequently. Regarding the administration of the treatment itself, again, it's done under general anesthesia.
Okay.
A slight electrical stimulation is delivered through electrodes placed on the temples, triggering a brief seizure which primarily affects the brain. Patients are awake within 5 minutes and monitored in the PACU prior to being discharged home. The entire process from arrival to discharge takes about 2 hours.
Okay. Wow. So it's only like 5 minutes of the actual procedure.
Yes.
Okay.
Very short.
And so what's the other 2 hours? Just waiting to make sure they're okay after the procedure, or?
Yeah, the initial part, your vitals are taken by a nurse.
Yep.
They have to do an IV, and you're given medication, muscle relaxers, so you don't have a convulsion throughout your body. That's why the stimulation just affects the brain. Patients do tend to have very minor muscle aches. Other side effects could be headache and some short-term memory loss, which typically resolves when the treatments get spread out.
Very interesting. And then recovery, so you said that they can come back a few times a week, so recovery
Yes.
is pretty quickly after this, right?
Oh, yeah. So after the treatment, they're monitored in the PACU for about an hour at most, and then they're discharged home. That day, they're advised not to drive or do anything strenuous, but by the next morning, they can resume normal activities. And they could even have ECT again the following day.
Wow. Okay.
Yeah.
And so this is something that we do regularly here at Morton now.
We do.
Okay. It's like how many do you think we do per week?
We do we administer up to 25 treatments about a week.
Okay. Wow. Okay. And that's up in our day surgery center, basically?
Yes.
Okay. Very interesting. Well, I definitely want to learn more about this. I have a couple more questions for you, Dave, but unfortunately it is time for us to take our first break of today's show. So we hope you'll stay with us, and we hope our listeners will also stay with us. We'll be right back with more with Dave from our psychiatry team, talking about ECT, a new treatment option here at Morton Hospital for many different types of mental health issues. So we'll be right back after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to Morton in the Morning. I'm your host, Julie, and today we are sitting here with Dave of our psychiatry team, and we are talking about mental health services here at the hospital. Before we get back into our interview, just a reminder about how you can contact us here at Morton in the Morning. You can reach out to us anytime at our email address, which is mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. We would love to hear your feedback or any follow-up questions you have. And also, we'd love to hear your suggestions on what topics you'd like to hear about on future Morton in the Morning shows. So reach out to us anytime, mortoninthemorning@steward.org. If you're just tuning in, we are here with Dave Vertuka of our psychiatry team. He works over in our outpatient psychiatry clinic, and we have been talking about a somewhat new procedure happening here at Morton Hospital. We've been doing it for about a year now. It's not new in terms of the actual procedure itself. It's been around for quite some time, and it's known as the gold standard for treatment for things such as severe depression and other mental health concerns. And Dave was just telling us about what ECT is. So given this is, a procedure up in the day surgery clinic, it involves, an electro pulse, whatever you call it.
Mm-hmm.
Yet how do you, when you're telling patients about this as a treatment option, how do they typically react, and how do you ease their fears about it if they have any fears?
Yeah, if they don't have any previous understanding of it, then they naturally will have a lot of questions, and there may be some apprehension about it. And a lot of the general fears come from mischaracterizations of the media or in movies.
Okay.
So,
Sure.
But in reality, ECT is highly effective and a safe treatment. We provide extensive education to our patients. There's a comprehensive clearance process, and patients are closely monitored before, during, and after treatments by physicians and nurses. It's a really great option for patients who haven't responded to other forms of treatment. Instead of living with hopelessness, ECT can turn your life around. We've seen it many times.
Okay, excellent. That's really great to know. So I think this is the first time we've ever had anything like this at Morton Hospital, and it's probably pretty new to our community as well, at least our area. So you said they had it at Norwood, but
Yeah.
I've never heard of that anywhere in our surrounding towns or anything like that at any sort of facilities. So
Yeah, we're the only program in the general area.
awesome. Okay, and I know that we also work with a lot of community partners. Do we get a lot of referrals from like places like CCBC? What are the types of places that refer patients to us?
We get a lot of referrals from community-based providers, CCBC as an example, and we get a lot of referrals from other inpatient facilities,
Okay.
Taunton State Hospital, and some other facilities in the area do send us quite a few referrals.
Okay. And now, given the fact that we have our behavioral health unit, our elder behavioral health unit, do you ever find, patients up there, because I know Dr. Batista works closely with the patients up there as well, that some of the patients up there are also good candidates for?
Yes.
Do you find people internally that you might recommend it for?
We do. The majority of our clients are outpatients, but we do provide ECT for our inpatient patients, and we have one or two probably on average per week. It's a smaller unit, about 16 beds.
Yeah.
So the old program at Norwood Hospital had 61 inpatient beds.
Oh, wow.
So there was a
Yeah.
large pool from which,
Sure.
so we had more patients inpatient at that facility.
Yep. Okay. Now, as far as referrals go, can people sort of self-refer to this? Like, can they call up and say, I think I could benefit from ACT, or how do you determine, if they are a good candidate?
Sure.
Do you need a referral, first of all, from a provider, or can patients just call and come in? And then the second part is, how do you determine if they're a good candidate?
Yeah, ECT does require a referral from a PCP or an outpatient psychiatric provider. Certainly, we're always available to take calls, answer questions, and provide education and guidance.
Yep.
So when we get a referral, initially, the patient has to be medically cleared. So that requires a history and physical, some blood labs, and an EKG. Mm-hmm. That information is forwarded to our office. It's reviewed by our proceduralist, Dr. Batista, and the head of anesthesia, Dr. De Leon. And if everything looks good, then a consultation appointment is scheduled with Dr. Batista in our outpatient clinic.
Okay. And is ECT something that, you would just, if you think the candidate, is well qualified for that, you would just do right from the get-go? Or is it something that you try to work up to? Like me might try the typical, therapy first, and then, if that doesn't work, lead up to ACT? Or is it just as normalized as any other type of treatment?
Yeah, typically the patients referred to us have had multiple medication trials that have failed.
Okay.
So generally, when we're getting a referral, those previous attempts have already occurred.
Okay. Gotcha.
But if we do have a new patient in our clinic, for example, who has not had prior treatment of any form, Dr. Batista generally will start with, if it's someone who's experiencing depression, we'll start with an antidepressant and try different trials of medications, and if that's not successful, ECT would be a viable option after that.
All right, so the most important things to know: it's safe, it's effective, it's been around for a while, we do it really well here, and you've seen some really great benefits or improvement in people's lives.
Yes, we have.
Okay.
Yes.
Well, that's great. I mean, it's been very interesting. I know, in the past we had interviewed Dr. Batista on the show, but I think it's been over a year, and that was really when we were getting the program just up and running. So it was brand new. He referenced it briefly, but it was good to get a little bit more of an in-depth look at what ECT is now that our program is really taken off here at the hospital. So anything else you want the community to know about the services we have here?
Just reiterate that we are always available to take calls, answer any questions, provide guidance on how to have a referral sent to us, and that it is a viable option for patients who are suffering from depression or other mental health conditions, and don't hesitate to reach out.
Okay, great.
Take advantage of the resources in your community.
Absolutely, and we have incredible resources in our whole psychiatry team is just amazing. We hear such wonderful things about them, and they sort of really touch every area of the hospital: inpatient, emergency department, the outpatient clinic, and also working so closely with our community partners. So definitely, as you said, a really great resource, and we are here for the community if you need us. So Dave, thanks so much. I appreciate your time today and telling us about the ECT program.
Yeah, thank you for having me.
All right, we want to thank Dave for sharing so much great information about ECT, which is one of the newer programs that we have here at Morton Hospital, talking to us about what that is. It's a really great, really gold standard, safe and effective treatment option for patients struggling with severe depression and other issues, as Dave had mentioned. And we are going to continue today's show talking about mental health because of the fact that it is such a very important topic that many of us can relate to. Many of us, either ourselves or family members or friends, have struggled with mental health concerns. And we are going to bring in next another member of our psychiatry team. So our second guest for today is Dr. Doriana Morar. She is another member of our psychiatry team, which is growing here at Morton Hospital, and we're so excited to have her. So welcome, Dr. Morar.
Thank you for having me.
Okay, so tell us all about yourself and your background.
I'm a physician trained in psychiatry. I completed my medical education in Romania.
Okay.
And then I completed my psychiatric residency actually at one of our sister hospitals at St. Elizabeth's Medical Center, Tufts University. I have 14 years experience working as a psychiatrist in hospital emergency rooms.
Okay, and how long have you been with our team here?
A year and a half.
Okay, wow. Seems like longer. And did Dr. Moldovan also complete her schooling in Romania?
Yes.
I thought so.
She actually went to the same medical school.
Oh.
Located actually in Transylvania, the real Transylvania, which is a region of Romania.
Okay, and you didn't know each other before this, or you did?
We knew each other. We worked together at Rhode Island Hospital for many years, together with Dr. Batista.
Wonderful.
Yeah, it just happened that we were given the opportunity to make a good team here.
Yes, and we are so grateful for that because, as I mentioned, our team has really grown. We started with just Dr. Batista, I think, back in maybe late 2020, and then after that, Dr. Moldovan, and then you joined, and now we have Brienne, who is the LICSW, and now we also have Rebecca, and also many other members of the team, which is great. So what interested you about the field of psychiatry?
That's a very good question. For me personally, it was this amazing opportunity to move to this country in 1997, which coincided with exceptional advances in medical science and specifically in neurosciences. And I think this new perspective and new life and new country made psychiatry a very fascinating specialty.
Okay, and you're still enjoying it to date.
To date, my enthusiasm is almost equal to the one I had in residency.
Great. Okay. So I understand that you also have a specific role within our emergency department. So can you tell us a bit about that?
So being an emergency psychiatry department team, I have the unique opportunity to work with both the behavioral health team and the emergency medicine team to provide adequate and rapid evaluations and care to the emergency room patients.
Okay, great. So do you also work with our inpatients here in the hospital as well as in outpatient psychiatry, or are you just dedicated to the emergency department?
So about 50% of my work week is dedicated to the emergency department. And of course, like in any hospital, emergency department patients take priority for care and evaluation. But I also see patients who are admitted medically throughout the hospital for psychiatric consultations. And we are so fortunate that we have hours, dedicated time in our patient clinic where we provide ambulatory psychiatric consultations for oncology clinic patients and for weight management clinic patients.
That's right. I know that many weight management patients, especially if they're having surgery, the psychiatry visit is often required or at least recommended for many of those patients. Okay, so I mentioned earlier that the team has really grown. So how has that felt to see the team grow so rapidly here at the hospital?
Actually, being part of this fairly new, because we're talking maybe end of 2019, and constantly growing team here at Morton Hospital has been very rewarding, professionally and personally. And I think it has also been a great incentive for all of us to grow professionally and to strive to offer the best patient care for the community.
Okay, wonderful. And we've been so excited that program has grown, and there's obviously a need for it. So I definitely want to talk to you more about, the work that you're doing in the emergency department, because, on one of our recent shows, we spoke with Brienne just about the impact on mental health overall with COVID and everything else. So I know that we've certainly probably seen a slight increase of mental health patients in the emergency department. But before we do, we are almost halfway through our show, which means it is time for another break. But don't worry, we have lots more to go with Dr. Morar talking about mental health and the great care that she offers both in our psychiatry clinic, but also in the emergency department. So time for our second break. We'll be right back with more with Dr. Morar. Stay tuned and stay with us after this short break.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning, everyone, and welcome back to the second half of today's Morton in the Morning show. Like our show last week, again today we are talking about the topic of mental health and wellness because it is such an important topic to talk about openly, to share resources. There might be people out there listening who themselves are struggling with a mental health concern or know someone who is. So this show today is dedicated to talking about all the great resources that are here right at Morton Hospital. And today we are interviewing Dr. Doriana Morar. She is a member of our psychiatry team. She does see patients in the outpatient clinic as well as does consults for our inpatients. But she also plays a very specific role as part of a behavioral health care team in our emergency department. So how specifically do you support those patients during their care?
So first of all, with the introduction of our psychiatric consultation team in the emergency room has been a novelty in itself. At this time, we have a psychiatrist and a psychiatric nurse practitioner seeing behavioral health patients in the emergency room every weekday.
Okay.
The patients who come in and they have need for behavioral health evaluations or care, they can be seen, evaluated by the psychiatrist or psychiatric nurse practitioner within 24 to 48 hours of their arrival to the emergency room. They can be started on medication. This is a novel process in our hospital because it's aimed at providing better patient care. Sometimes it can reduce the need for inpatient psychiatric admission, can shorten the patient's length of stay in a hospital, or can even change their disposition.
Okay. And now, aside from, this sort of being like a new program, are there any new initiatives that you've implemented? Maybe you started seeing patients in the emergency department and thought, well, we really should be doing this, or any special programs that you've helped to incorporate into the ED care?
So we are working on making sure that we provide adequate support to the behavioral health navigators in the emergency room, both with diagnostic evaluations and disposition decisions, which ultimately the goal is to reduce the patient's length of stay, the patient's length of time boarding in the emergency room, and as such, the patient's outcomes.
Okay, and so you work very closely with the behavioral health navigators.
Yes, we're basically two teams who work together, and then we align our evaluations and support with the emergency medicine team.
Okay, and obviously an emergency department is not always an ideal place for these patients. We have great services to provide while they're here, but what are the types of services that you refer them to for long-term care or short-term care after they're in the emergency department?
So for patients who are safe enough and stable to be discharged from the emergency room, we refer many of them to our own outpatient psychiatric clinic, which is, like you said, growing, and we're hoping to see it grow even further. We also refer patients to the local community mental health center, which is the community counseling of Bristol County.
Okay.
I personally refer patients to Bristol Elder Services. This is for the, elderly patients who are seen by our team. Over the years, I've learned that referring patients and families to the NAMI, N-A-M-I, which is the National Alliance on Mental Illness, is very, very effective because as we all know, NAMI provides support for the families and for the patients, and sometimes by peers, by people who have experienced their distress and can be a good source of support.
Okay, great. So, thinking ahead, I know it's somewhat new to have this whole team that sees patients in the emergency department. Are there any goals for the future to see this program expand?
We would love to see our, emergency psychiatry team grow. our immediate goal is to be able to provide the same level of availability for psychiatric consultations for behavioral health patients in the emergency room during weekdays and holidays. That's one of the immediate goals. So basically, we would like to see the team grow and provide even more comprehensive support for behavioral health patients in the community who come to our hospital.
Okay. And, this is such a relevant topic. I mean, I think most people probably know someone who is struggling with mental health and wellness. Aside from the patients, I think it's often, family members often have a hard time dealing with it too. So how do you work with the families? What advice do you give them as they too are struggling alongside the patient?
I love this question. Being an emergency services psychiatrist, I make a point in talking with the patients' families about being prepared for a crisis. No one wants to worry about the possibility of a crisis, but crises do happen. So I discuss with the patients' families the need to have a crisis plan in place, that the patient has to be part of the plan. They need to know who to call, where to go, how to get there. So they need to be prepared. As important, I feel that I advise families to take care of themselves. They need to take care of themselves so they can be there for their loved ones in a moment of crisis. And what I tell families is exactly the advice given to travelers on airplanes. First, you have to put your oxygen mask on, and only that you should try to help others.
Yeah, that's really great advice. So, if you do refer a patient to follow-up care in the outpatient clinic, are the family members allowed to go with them to those appointments, or does it have to be private?
So that's a very good question. As long as the patient is agreeable, so it's the patient's autonomy and right to make decisions. As long as the patient is agreeable, we actually welcome the presence of family members or their supports in the community during the initial evaluation and during the treatment in our clinic, and we are very open to have the family participating in treatment.
Yeah. Do you find that patients maybe are a little bit more open with their feelings when they have a loved one with them who they're comfortable with? Does it make them more comfortable being there and talking with you?
I think that depends on the patient and the situation.
Yeah.
But, in order to make the patient comfortable, we first meet with the patient face-to-face, our first or second evaluation. And then if the patient or the family are expressing their desire to have family present, then we actually we discuss with the patient. So what are the topics you would like to have discussed when your family member is here? So we prepare them because our goal is to establish the best professional relationship with our patients and to actually help patients feel we're there for them.
Yeah, after I asked that, I could see it both ways. I could see that maybe some people might be more comfortable having someone they know with them, but on the reverse, maybe they're struggling with some issues that they haven't told their family member about or they don't want them to know about. So it's probably better just to meet with somebody who can focus on helping them and, no judgment, anything like that.
Yes, that's true for most patients. And again, situations and events occur. And we pride ourselves in being very open-minded, and our staff, clinic staff, knows the patients. We know the patients. We know the community, the family. So we feel that we can provide a safe environment where the patients can actually, feel comfortable asking for help.
Sure. And one of the topics that I talked about with Brienne when we had her on the show, we talked a little bit about the stigma associated with mental health. How do you try to reduce that, especially with the family members of the patient who maybe this might be new for them?
So it's interesting you ask this because it's mostly the patients themselves who struggle with having been judged, stigmatized because of having mental illness. I think because of education, because of hospitals and physicians being more present in communities, families are actually appear to be more understanding and supportive. But I find in my practice that patients feel stigmatized.
Yeah.
So, I use being, a physician, I use this example of what if instead of having bipolar, you were told today that you have diabetes and you were told you have to be on a diet and take medication for the rest of your life. Would that feel shameful? Would you feel ashamed or guilty? And many patients respond to that. So we try to normalize their experience and to, again, establish a sort of professional relationship that really shows patients we're there for them.
I think that's such a great example. If someone's told that they have a medical issue, more likely than not, they're going to act on it and they're going to seek services and not just going to ignore it. And I think hopefully more people start to do that when it comes to their mental well-being, because the longer you ignore it, things could get worse, right? I mean, if you don't seek treatment. So what else would you like our community to know about the services that we provide here?
So I think, for the brief duration that we've had our psychiatric team in the emergency room, I would like our community to know that we provide patient-centered care, which is very important in the psychiatric field. We provide it in a safe environment. And I think the most important is that patients in crisis have fast access to adequate emergency psychiatric evaluations and treatment.
Okay. And is there anything you can think of, new that might, or exciting that might be coming down the pike in terms of the services that we offer?
So as far as the emergency room, like I said, we are striving to improve the quality and the promptness of the services by having the team grow. I've had discussions with our chief, Dr. Batista, and with team members that, overall in the psychiatry department at Morton Hospital, they're looking into opening a clinic for treatment-resistant depression that would include other treatments than just medication and therapy, like TMS.
Okay.
And also we are hoping to expand our outpatient psychiatric clinic in order to provide, like I said, the niche care for different clinics in our system, including the oncology, the weight management, the pain clinic. Because in psychiatry, we look at the patient as a whole, brain and body, and we would like to continue this approach because it has been proven to be successful and effective.
Sure. And earlier in the show, we spoke to Dave about ECT, which is the electroconvulsive therapy that we've had, I want to say at least for about a year now, and that program is growing. You mentioned TMS. What is TMS?
So TMS is another treatment for certain psychiatric illnesses. Specifically, it's FDA approved for treatment-resistant depression. So for patients who have tried several antidepressants, several medications, and their depression is not improving. And it's good you mentioned ECT. ECT is actually a classic, verified, FDA-approved treatment for treatment-resistant depression. And the newer treatment that we were talking about and we're hoping to bring to our clinic is actually TMS, which stands for transcranial magnetic stimulation. It is another FDA-approved treatment for depression, and it's non-invasive, safe, and it's a form of brain stimulation based on magnetic fields applied to specific areas of the brain. So again, treatment-resistant depression is a real issue in the society and especially in the psychiatric field. So we feel the more alternative treatments or alternative treatment options we bring to our patients, the patient's outcome will be improving.
Okay. Great. Well, it's wonderful that the team is, thinking of all these different treatment options that we could possibly bring here to Morton and, make the services more advanced. But also, like you said, for things that aren't working for people, having other options that are safe and effective for them. So, this has been wonderful. Thank you. One last question. I just want to hear from you. What is most rewarding to you about the work that you do?
So, the most rewarding phenomenon I feel in psychiatry is actually seeing patients able to connect with you, the physician. And once you achieve that as a psychiatrist, the rest comes very easily. And again, we see patient improvement, not only symptoms of depression, but we see improved quality of life, improved ability to take care of our own health as patients, and improved ability to connect with patients and families, and ultimately with the community who provides so much support to our hospital and our clinics.
Absolutely. Well, thank you. I appreciate that, and I want to, thank you and the whole team for the incredible work that you're doing, and all the, you're helping so many people. So we appreciate having this team here, and we appreciate your time today and sharing all the great things that are happening in the emergency department and the clinic with regards to mental health care. So thank you, Dr. Morar. We really appreciate it and hope to have you back soon.
Thank you so much.
All right, it's time for the last break of today's show. We'll be right back with some more hospital updates as we wrap up today's show. Stay tuned.
We'll be back with more of Morton in the Morning in just a few moments here at WVBF.
Morton Hospital's nationally accredited Center for Weight Control has grown with the addition of Dr. Deepthi De Silva, our new Director of Medical Weight Loss Management. Our center now offers high-quality medical and surgical weight loss options close to home, with medical weight loss appointments now available in Taunton and Middleborough. To learn if you qualify for weight loss surgery or medical weight loss and to schedule a consultation, call our Center for Weight Control at 508-301-2434.
And now back to Morton in the Morning here at WVBF, Hometown Talk Radio.
Good morning and welcome back to the final segment of today's Morton in the Morning show. If you are just tuning in, we had two great special guests today. We had Dave Vertuka as well as Dr. Doriana Morar of our psychiatry team here at the hospital. We talked a lot about some new programs and initiatives at the hospital geared toward caring for patients with some mental health concerns, both in our emergency department as well as a new program called ECT happening here at Morton Hospital. It is a treatment option that is done up in our day surgery unit, and it is the gold standard for treating certain types of mental health conditions such as severe depression. So great information shared by both Dave and Dr. Morar. They're doing amazing work in offering so many resources to our patients all throughout the hospital, both in the emergency department, the outpatient setting, and on the inpatient units, as well as within our elder behavioral health services unit here at the hospital. If you missed those interviews, don't worry. We do post a link to listen online to our interviews on our Facebook page. We will have that up by this weekend. Go to facebook.com/Morton Hospital MA. Follow our page, like our page. You'll see the links to our radio shows there, as well as many other updates on what's happening here at Morton Hospital. You can also find information about our behavioral health services on our website, mortonhospital.org, or give our outpatient psychiatry clinic a call. They can go through all the different services offered and find out if you are eligible to come on in to the outpatient clinic or need some other type of service that they may be able to refer you to. So to get in touch with our outpatient psychiatry clinic, you can call 508-828-7880. Again, that's 508-828-7880. We have a really great team over there. In addition to Dr. Morar, we have two other doctors. We have a couple of mid-level providers, and we also have Dave as well as the other support and office staff over there who provide great customer service and overall great support to all the patients who need these services here at Morton Hospital. So give them a call, check out our website, and find this interview online on our Facebook page if you missed it, because a lot of great information was shared. So before we wrap up our show, I wanted to share with our community that we have welcomed 2 new mid-level providers to both Morton Hospital and Steward Medical Group. First, we have Erin McDonough, and she is a nurse practitioner. She specializes in pain management, and she has joined our pain clinic team here at Morton Hospital. We're so excited to have her join our team. Our pain clinic, if you didn't know, is located right here inside the main entrance of the hospital. It's up on our day surgery unit. We have a great team up there. They specialize in treatment and diagnosis of a variety of chronic pain conditions. Erin is now accepting new patients. If you want to learn more about our pain clinic or schedule an appointment, you can give them a call at 508-828-7186. Again, our pain clinic, 508-828-7186. We also very recently welcomed Caitlin Martin, and she is an FNP, which stands for Family Nurse Practitioner. So she sees patients of all ages, and she has joined our Steward Medical Group Primary Care at Northwoods office. They are right up on Bay Street in Northwoods Medical Center. There is a large team of providers that practice out of that office. She is also now accepting new patients at SMD Primary Care at Northwoods. If you want to schedule an appointment with Caitlin or any of the other providers up there, you can give them a call at 508-822-2266. Again, that's 508-822-2266. And again, if you're looking for any type of doctor, outside of just primary care or pain management, you can find a whole listing of our providers and specialists here at Morton Hospital on our website, mortonhospital.org. And you click on our Doctor Finder page, and there you can search doctors by name, you can search by specialty and location. Lots of great resources for you, so check it out if you're looking for a specific type of provider. Then you can find someone right online on our website through our Doctor Finder tool. So welcome, Erin and Caitlin. We are very happy to have you as part of our growing team of providers and specialists right here in the Taunton area. So a few more minutes left in our show, and if you missed the beginning part of our show, we mentioned that the 2022 Best of the Best Community Choice Awards are up and running. And we are so excited because we have been nominated and made it to the top 5 in 6 different categories this year. And a couple of new categories, which we are grateful for. So we want to thank our community for nominating us during the nomination round. So the categories that we have made it to the top in are Best Hospital/Medical Center, Best Audiology Specialist, Best Orthopedic Center, Best Places to Work, Best Physical Therapy, and Best Weight Loss Center. So we are thrilled. It's really a testament to our entire team here at Morton Hospital that our community and our patients are recognizing the great service that they provide. So thanks again for all who nominated us. And the voting period kicks off next week. So that will run from August 9th through August 23rd. You can vote once a day, every day. You can vote for us in all of those 6 categories. And you can find the voting link. We will be posting it on our Facebook page, facebook.com/Morton Hospital MA. You can also find it on the Taunton Gazette website or the Brockton Enterprise website. So these awards are for the Metro South region. And again, we are so excited to be in the running for those 6 categories. We hope to make it to the top 3, and we hope to bring home some of those awards to celebrate our team. So thank you again to everyone who nominated us, and thank you in advance to everyone who would like to vote for us in those 6 categories for the 2022 Best of the Best Community Choice Awards. And as a final reminder, if you've missed any of our shows, we've done some really great new shows recently. You can find them and listen to them online through our Facebook page, facebook.com/Morton Hospital MA. Give us a like and follow us. We always post the link to our shows by the end of the week so that you can listen online if you missed it, because lots of great information has been shared. And then also a reminder about how to contact us here at Morton in the Morning. We have a special email address, which is mortoninthemorning@steward.org. That's MORTON in the morning at STEWARD.org. So we'd love to hear from our listeners. If you have any feedback you want to share about any of our shows, any follow-up questions, maybe you missed a phone number to one of the services that we were promoting, or we would also love to hear your recommendations for topics that you want to hear about on future shows. Give us a shout, send us an email, mortoninthemorning@steward.org, even if you just want to let us know how you're enjoying the show. We'd love to hear your feedback as well. So it's about time to wrap up today's show. Again, I want to thank our special guests, Dave and Dr. Morar from our psychiatry team, for the great information and resources and advice that they shared with us today, all about our psychiatry program here at Morton Hospital. And we look forward to bringing you some new shows in the coming weeks, some things that we have planned. We will be interviewing some members of our MORCAP team. That is our substance use disorder treatment unit. We definitely want to give our community an update about how that's going since we first opened back in November. So you definitely want to listen in the coming weeks and hear that show and many other great interviewees that we have coming on in the next few weeks. So thanks again to everyone for listening today, and we hope that you'll join us again next week, every Wednesday, 11 a.m. right here on WVBF, your hometown radio station. From all of us at Morton Hospital, we hope you have a happy and healthy week, and please remember to vote for us starting next week in the 2022 Best of the Best Community Choice Awards. From all of us at Morton Hospital, thank you to our community for voting for us in the 2021 Best of the Best Community Choice Awards. We're honored to have been voted Best Hospital, Best Audiologist, Best Hearing Aid Center, Best Physical Therapy, and Best Weight Loss Center in the Metro South region. Learn more about our services and quality achievements at mortonhospital.org and follow us on Facebook to stay up to date on what's happening at your award-winning community hospital.